BusyBox's expert information on STI testing. What happens during an STI test for a man?
STI, STD testing is generally straightforward. So there are a couple of hurdles to STD testing. One is people have a perception that it's going to be terribly painful. Usually it isn't terribly painful because it just involves collection of urine and or painless swabs and sometimes some blood tests. So we would test for syphilis and hepatitis and HIV using a blood sample. For chlamydia, gonorrhea, we would test using either urine or a swab. There are, and there have been, until fairly recently, there have been tests where we've needed to take quite painful swabs from people. We don't need to take painful swabs from people any longer. So all we need them to do is to save some urine, i.e. not go to the toilet for a few hours, and we can reliably diagnose STDs on those samples.
What happens during an STI test for a woman?
Testing for STDs for males and females is largely the same. So we just collect samples from the sites that they've used sexually. So if they've had oral sex, we take throat swabs. If they've had genital sex, we take obviously swabs from their genitals. I guess the most off-putting thing is the slight embarrassment of having to discuss it and reveal your genitals, but you know, the tests are themselves straightforward. The whole thing is very fast.
What happens when a swab is taken?
When we're taking swabs from women, we use what's called a speculum, which is a plastic disposable single-use device that we just open the vagina with so that you can see the cervix and take the swabs. But in actual fact, for most women are much more comfortable seeing doctors than males.
How do I limit the chances of getting an STI?
To limit the chances of acquiring an STD, STI, then there are a range of different options. And use of those options is very much an individual choice, and some people find some of those options not palatable. So if you were to be ultra cautious to avoid getting an STD, then you'd use a condom for oral sex and also for penetrative sex. Females can protect themselves to a degree against STDs by using female condoms, femidoms, and STDs can be spread also obviously by oral sex. So for people having oral sex with females or having oral anal sex, then you can protect against those by using what are called dental dams, which essentially is a plastic device that you apply between the area that you're having oral sex with and your mouth.
www.busybox.com